The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle, live in studio, waiting to take your call on your health and find out anything you want to know about what hasn't worked for you, right? You've tried, you've applied, you've done all kinds of things. Well, here's an opportunity. Give us a call. 888-630-9625. That's 888-630-9625. Love to talk to you on this beautiful Washington day. Having said that, we have a topic we're going to kind of explore with you today, and one that really, is, it's totally embracing. It's encompassing virtually about anything that can go wrong unbeknownst to you over a period of time. We're talking about your immune system, managing autoimmune diseases, and we're going to talk about it from a very specific platform. So, if you have rheumatoid arthritis or Hashimoto's or a Graves' pattern, a Sjogren's pattern, irritable bowel, Crohn's, MS or MS-like conditions, eczema, psoriasis, colitis, lupus, what do all those things have in common? Well, they have to do with your immune system not working the way it's supposed to, but we're going to talk about it from a very, very specific way. We're going to talk about it from Asian medicine, managing autoimmune diseases and conditions with Chinese medicine. And who better to discuss that topic than Dr. Stephanie Pina. Hi.
Hi.
This is, when we talk about immune system, we talk about Asian medicine. Obviously, I've had the privilege of traveling, to China and studying there a couple different times. And, a lot of things that, that we in our practice at the Roselle Center, we hold as kind of basic truths. Once you're there and you see them applied across the board in a very traditional manner, your brain goes, oh, got it, understand. But this Wednesday evening, I think it's the 5th, right, Wednesday evening?
Yes.
You're going to be talking about this subject. And I want to get into this whole blanket, if you will, that covers every immunological response, whether it's just the common cold and somebody's getting sick all the time, or they got an irritable bowel problem that nobody seems to be able to settle down. The approach has to be across the board. And the first question that I think that we need to initiate is, people hear the term Asian medicine or traditional Chinese medicine, and is it specific? But more importantly, really, what does that mean? What is that terminology? What does it really mean?
I think it's always interesting to bring that up first because when you think about it, I would say acupuncture always gets the glory. That's a technique within an entire medical system of Chinese medicine. So really what you're taking with Chinese medicine is the way we observe life with nature and outside, inside, how we observe things kind of going together. And it's bringing together how do you balance lifestyle, diet, exercise, activity, and our health functions all together and look at it from a slightly different perspective. And so 3,000 to 5,000 years ago, Chinese medicine really started to come together and there were texts written, and some of those same texts are the same ones we use now when we learn Chinese medicine here in the U.S. and a more modern way of doing Chinese medicine. But when you're looking at it, you're really looking at how can we get the body to function the most optimal it can within the environment space that it has. So when you're looking at something like autoimmune diseases, you have to recognize what is a normal response and when is it going over the top. And so that doesn't always require labs and imaging and all the other great things that modern technology has brought in there. It's just looking at it from a different perspective. Back in the day, 3,000 years ago, they didn't have any of that. So really, observation becomes a major tool, and then talking with patients to kind of figure out what are they experiencing and taking into effect all the environmental outside and their internal factors, such as everything between emotions, our dietary lifestyle, our mental mindset. All that gets played into when you talk about how to diagnose in Chinese medicine and then what therapies are best to use it, because acupuncture is just part of it, but so isn't dietary therapy, exercise, herbal medicine. It's its own unique system. So really it's a different way of looking at health and wellness.
You know, there's a book that's used in the majority of acupuncture schools and traditional Chinese medical schools. It's one, that I read years ago and continue to have a copy that I refer to, and it's simply called The Web That Has No Weaver. And what we're talking about is this intimacy, if you will, this hand-in-glove application of body systems. And in Asian medicine, as you said, in traditional Chinese medicine, it's a look at what's happening in different compartments in the body, but how they relate to each other. You mentioned, all the wonderments of modern medicine with CAT scans and blood work and, ultrasounds and, genetic markers and so forth. But at the end of the day, those things still compartmentalize what's going on in the body. It shows the end product, the end result of something gone wrong. What we're talking about is what's happened before that. Where are the things that are actually breaking down that ultimately bring about that symptomological presentation and then that underlying, if you will, disease situation that we're dealing with? Yeah, some of the modern books like The Web That Has No Weaver, because we had to read that in naturopathic school and in medical school. It's a tough read, though. I'll put it out there. You got to get ready for your Chinese medicine terminology. Indeed. But there's another one that I like a lot too that came out that looks at it from a modern perspective too, called The Spark in the Machine. It's written by an emergency room doctor in Great Britain, and how he pulls things together. It's very interesting. But when we look at it, we can't just look at, did we change your markers? Are you just your lab work? Because clearly you could be feeling horrible and your lab work looks completely normal. So something like Chinese medicine, there's other ways of diagnosing how that patient may have had their immune system go off, their digestive tract go off, or their normal cycles like sleep cycle, eating cycle, or stress cycles. How are those functioning within the body, and what organ systems are they affecting, honestly? We talk about, particularly in the office, when we talk about different cases, we talk about the relationship between Eastern and Western applications. And one of the terms that's used in Asian medicine is qi, or energy, in some areas prana, if you will. And in this country, in Western application, we talk about the constitution of the human being, the strength, the internal capacity. They're basically similar. And so when you take away the cloak of the unfamiliar terms and you try to relate them to Western terms that have some meaning, people say, oh, I get it now. And what we're talking about is this whole intimacy, the epigenetic patterns that are on the front lines today, meaning that everything that happens to us is a result of all the exposures that stimulate our genetic map. This is basically what we're talking about, is understanding the energetic platforms, the biochemical exposures, the emotional overlays that in the body, ultimately causing either strength or weakening in this immunological response, this immune system causing those things that we talked about. Because whether you're diagnosed with a Sjogren's or a lupus condition or an irritable bowel problem, or you have a Hashimoto's thyroiditis or whatever, and the list goes on, or cancer, it's all about what we're talking about. Yeah, absolutely. And, when we see patients come in too, I think it's amazing because a lot of the medications that someone might be on, they're cancer medications and they're autoimmune disease medications. So really you can apply some of those same principles to treating and supporting a cancer patient the same way you would an autoimmune patient. But really that underlying, why is their immune system not functioning? What got to us to the point? Because if it was everyone and it was just, say, environmental exposures or it was just genes, we wouldn't have a chance to combat any of this. If you think about it, we all have genes. If they weren't always turning on, we need that trigger. Well, what has someone triggering versus someone else? Why does someone develop rheumatic fever and lupus, say, versus the person next to them? A very dear friend gave me a book last year. It was called A Crack in Creation. And it talks about how the body's genetic revelation, if you will, how the body represents itself and how it's suppressed by all the immunological responses that we're talking about. There's a mnemonic out there called CRISPR, and it's really about how the alphabet soup within the genetic map actually can shift and change and either express a problem that really shouldn't have been expressed, or one that was predisposed because of genetic markers, BRCA markers, and so forth, and completely disappear. They go away totally. And even to understand everything that has to do today with the work that's doing in regenerative medicine, to understand that really is the key. But this is what we're talking about. That profound effect that, you laid out briefly is how that affects the whole body's ability to express itself, if you will, or inhibit itself, and subsequently being subject to not the most positive responses, tumor formations and inflammatory reactions and degeneration and pathology and so forth.
Yeah, we have to take into consideration, not only the genetic effects, but also environmental effects, hormone effects, how the adrenals are working. It's never a one, when they talk about autoimmune disease, what's interesting is I've listened to a couple of podcasts and things in the last couple of weeks getting ready for this, and rheumatologists will come on there. We don't know what the trigger is. But what's interesting now is they're starting to realize that environmental stuff has something to play with it, but that's where they leave it.
Gee, really?
Yeah, can you believe it? They're catching up. But they're ready to give certain medications just to suppress everything. So instead of going, well, we recognize there's this effect of the environment and on us and internally, like our hormone, but they don't go any further. They just know the medications. And so what's funny is when we treat something like that and we don't look at all these outside factors, one, we're not treating the cause of the issue. And that may or may not be identical, but you can certainly create a system of healing that treats potential causes, potential other triggers as well, looking outside the box. But then you can also look at it as saying, well, why is this person responding the way it is, and why are they going this direction? It's not always about markers and everything that we've now learned how to segregate and put people into boxes of you have this autoimmune disease or not, because we know that there's an increased rise in an autoimmune disease, and we know that it's most likely when you have one autoimmune disease, it's going to trigger another one. And sometimes they're very
cascade.
Different types of diseases. A skin condition can turn into a thyroid condition, which can turn into a digestive condition. So how does that affect the body if they're all separate?
Well, here's an interesting situation. A guy who has never been a smoker ends up with lung problems, congestive heart failure, and things of that nature. Somebody who, is a smoker doesn't end up with lung cancer, but ends up with bowel cancer. And, what are the intimacies and the relationships? That is exactly what you're talking about. And, you can have even a minor irritation and exposure, it manifests, but to really understand how they flow and how they manifest, you really have to understand that cohesiveness, if you will, that intimacy of all systems of the body. This Wednesday evening at the Roselle Center for Healing in Fairfax, you have a unique opportunity to listen to, as far as I'm concerned, one of the most knowledgeable people on my staff, Dr. Stephanie Pina, a doctor of naturopathic medicine who's brilliant when it comes to putting these things together. Would you like to know why you have that condition? Would you like to know what you can do about it, more importantly? This is an opportunity. Take the time this Wednesday evening, 7 p.m. at the Roselle Center for Healing, and all you got to do is go online at rosellcare.com. That's ROSELLECARE.com, rosellcare.com. Or simply call the office at 703-698-7117. That's 703-698-7117. And tell our staff that you'd like to attend. It's no cost whatsoever, but it's our gift to you, our way of informing you and allowing you to have the tools that you need to be control of your health. Ageless Health, Health is a Do-It-Yourself program. When is a good time to get that started? Like right now? Pick up the phone and call. We're coming up to a break, and we're going to get deep into this conversation. We'll be right back. Don't go away. Welcome back, everybody. Dr. Tom Roselle here. You're listening to Dr. Tom Roselle live in studio with none other than the Dr. Stephanie Pina, Doctor of Naturopathic Medicine, and your host, your presenter, this Wednesday evening, June 5th. At the Roselle Center for Healing in Fairfax. She's going to be talking about managing autoimmune diseases, but more importantly, from a very different platform. She's going to be talking about how your body's immunological responses are managed and looked at through traditional Chinese medicine and Asian medicine. It's very important that you understand that your body is this interrelated hand-in-glove maze, this network of things. And when you have problems, when you start breaking down and you're seeing signs of cancers or thyroid problems or autoimmune conditions of Sjogren's and lupus and the like. There's a reason for that. There is a why is that. And if you're suffering from these kind of conditions, you want to know simply how to prevent yourself from getting there because it's been in your family for a period of time, guess what? This is an opportunity for you to really get it. So give us a call at 703-698-7117 and register to hold your seat. You can do it online. Just go to rosellecare.com and go halfway down the screen, and you're going to find a sign that says Free Health Education Lecture, Managing Autoimmune Diseases, Wednesday the 5th, 7 p.m. And click it and register, and we'll be delighted to have you there. Dr. Pina, let's walk through this maze, if you will, this web, this spider's web that has no weaver, a little bit more carefully. Seriously, when we look at any condition, we look at somebody who has MS, multiple sclerosis. We have somebody who has Parkinson's disease and so forth. From a Western observation, they have a defined tag, a diagnosis. And what they're defining and what they're diagnosing is the end stage, the pathology that now exists, not the path that it took to get there. So let's talk about that. That's that path. I know in Chinese medicine we don't have to get into it completely, but there's 6 stages, if you will, of breakdown of disease leading to condition. But what happens before we get to that pathological diagnosis of cancer, of irritable bowel, of rheumatoid arthritis, of ankylosing spondylitis? There's a whole path that has to be walked.
Yeah, it's always interesting because we talk about how the body has an innate immune function to try to heal itself. And it wants to kind of right the wrongs, and it doesn't mean that we don't get colds and flus and infections and stuff, but our body processes should be able to break that down and deal with it and clear it out of the way. And we talk about the fact that we always have cancer cells in the body, but until we stop having the ability to take care of that, then tumors start to form. So even when we're looking at it from Chinese medicine, we know that there are outside factors and inside factors, whether it's mind, body, emotion, or that pathogen or chronic disease or bacterial infection that can invade the body. And at the most upright levels, basically, we can deal with that. We can fight it off. And our body learns to fight that off. And so that's kind of one of our immune responses. We're supposed to be able to adapt to essentially our outside environment. Just like when we change environments, sometimes like when we talk about allergies, all of a sudden our new environment starts to bring on new stuff that we're not used to, so we start to have more of a response. But when that lingers and it doesn't get taken care of, and then you have other factors and another trigger, things start to go deeper and deeper into the body. And as long as it keeps continuing in that pathway, it becomes more difficult to treat. And sometimes if we don't have a strong enough immune response, we might not see any kind of response at all. There may not be a fever. There may not be achiness. There may not be joint pain and swelling or digestive issues because our bodies have become so weak with the fact that we have been trying to fight this off so long.
Too sick to be sick.
Exactly. So as we move in Chinese medicine to these 6 layers, we go deeper and deeper into the body, and so more and more organ systems tend to get affected, more and more lingering symptoms, which is what the diagnosis is in Western medicine. Here's our lab report followed by you have these things, so you must have this condition. Those are just the top layer of it, what we're seeing, but what's going on is underneath. It's kind of starting to tear us apart, and that's where autoimmune diseases, different types of cancers and stuff are really lingering, where it's like you can't find the right thing to treat it because essentially it's gone beyond our normal capabilities of breaking stuff down.
Now, it's really interesting, and how we look at diseases in the Western culture. We wait until it's too late. And it's a very typical statement that so many traditional physicians will say, "Let's watch it. Let's see what happens." Well, if you're going to watch something get progressively worse and not do anything about it until it gets to that stage, you've lost the essence of really what triggered it to begin with. You need to trigger the why.
And I feel like, especially with autoimmune diseases, this is a big thing because patients are coming and saying, I don't feel well, but they may show up normal in lab reports and everything else. But their story becomes so important because they're giving you more information than any lab report can.
I just had a patient that was diagnosed with colon cancer, and it had nothing to do with that if you had gone the traditional route. But looking at it from our route, it was very predictable. But we can talk about that when we come back from the break. My guest in studio, Dr. Stephanie Pina, your host, your presenter, this Wednesday evening, the 5th of the month, at the Roselle Center for Healing in Fairfax. Don't go away. We'll be right back.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back, everybody. You're listening to Dr. Tom Roselle Live. I am in studio. Call 888-630-9625. That's 888-630-9625. Let's talk about your stuff as well. Got an interesting program that we're getting into, and it's really managing autoimmune diseases, but manage them through a different perspective of traditional Chinese medicine and Asian medicine. You know, we're talking about things like Crohn's disease and irritable bowel problems, MS, multiple sclerosis, eczema, Graves, Sjogren's, rheumatoid, Hashimoto's, colitis, lupus. I mean, the list really continues to go on. I mean, straight up cancers. There's a reason why these things exist, and unfortunately in our society today, we don't look at the why, we look at the end product. We get to the place of pathology. Once you're at pathology, it's tough to handle that if you're only going to treat whatever the end thing is to try to dampen, put the symptom into quiescence. My guest in studio, Dr. Stephanie Pina, Doctor of Naturopathic Medicine, and be your host this Wednesday evening, the 5th, at 7 p.m. at the Roselle Center in Fairfax. Before we do that, I want to go to the phones and be respectful. Corinne, how can I help you? Thank you for calling.
Yes, sir, Dr. Roselle. I really appreciate all you do and your opinions, and you're really doing a great service for the community. I'm 64 years old. I clean for a living. I've been doing that for probably 10 years. I'd like to do that for another 10 years if possible. Both of my shoulders were aching. I went to the orthopedic surgeon. They took the MRI, x-rays. Both of the rotary cuffs are torn. And she said the only fix is surgery. I wanted to know if that's your opinion, if that sounds right.
Well, Corinne, there's a lot of things to consider first. And, so the short answer is maybe. But you have to find out if it's a full tear, then nothing's going to replace it other than surgery, and you have to go back in and put that together.
Both of them have small tears, she said, and if I don't do nothing, she says they'll just continue to get worse. And she said the results would be better to do it earlier than later.
So there's something called PRP, protein-enriched plasma, that can be injected into the joint, and then you put the joint at rest, and then you begin to do some rehabilitation, and in many cases, you can get some very solid resolution. If there's joint space degeneration, where the bone is beginning to break down, you can do human stem cell therapy, where you can inject that into the joint space. And by the way, the Roselle Center for Healing in Fairfax has begun adding a new dimension to the things that we offer. We have a doctor of naturopathic medicine, and not doctor of naturopathic medicine. I'm thinking of you, Dr. Stephanie. I'm very sorry. No, an osteopathic physician, a medical physician who has joined our team and is going to be doing that work, and from PRP injections and so forth, and we've started that. Matter of fact, on the 21st of this month, we're going to be doing, I think, a second or third group. So, and the results are amazing. But let's set that aside. That was a little promo on my part. But here's the situation. I've treated a lot of professional athletes, and as you can imagine, they destroy their joints. I've dealt with people who are golfers and tennis players and so forth. They're one-sided utilizations, and a lot of this stuff comes from the loss of neurological flow to the muscle, so the muscle becomes inhibited. And so when you use it in a normal fashion, now it begins to it becomes more susceptible, and you can tear, and you get these little fibrous breaks and so forth, and pretty soon it breaks down even more, and sometimes it gets fully destroyed. Now, I don't know you. I haven't seen your MRI. I don't know anything about it, so I can only be general. So number one, unless there's a full tear, it depends. If there's small little tears, then there's other things to consider, from acupuncture, which works very well with low energy light laser. You can use protein-rich plasma injections. You have to check the structural system of the spine, the neck, the nerves from the lower part of the neck go to the shoulders, and if those nerves are being irritated, stretched, or in any way slightly impaired by pressure, the signal to that muscle is not going to be effective, and the muscle is going to be inhibited and weak, and so subsequently the joint's going to be unstable. So you have a whole lot of things to think about and take into consideration. The short answer is this: if it is not fully torn, there are other options that should be explored first. And that's what I would encourage you to do. I mean, you're in Williamsport, Maryland. I'm not sure where that is. But, if you're anywhere near us, come in, have one of our great people take a look at you. If that's, you're further away, send a note through the office. Just say, can I get a referral? I don't know if I know anybody out in your area, but at least we could look. Does that help you, Corinne?
Yes, sir, it does. I just wanted to know one other thing, please, and that is she said that if I would do nothing for the rest of my life, they would just continue to get bigger. And then she said you're looking at shoulder replacements. Is that true, that they just get worse if you don't do anything about it?
Well, yeah. If the muscle's tearing and you don't do something about it, and if it's the muscles, the posterior muscles, if you're cleaning and so forth, the back muscles have to be nice and strong to support your front muscles. It's like in my business, I'm over a treatment table all the time, so I have a forward bent posture where my chest muscles, shoulders muscles, and biceps are going to be strong, but my posterior muscles aren't as stimulated, if you will, as the others. So you have to do some exercise, you have to do some rehab, there's nutrition that you can do. If you let the joint go, yes, it's going to break down. We have patients, who've had joint destruction, who we've had them do human allographic stem cell injections, and they've done very, very well, but they also have to do a little rehab to prevent it from coming around again.
Oh, okay.
Okay? So you can't put a Band-Aid on this. If you want to continue doing what you're doing, you got to approach it fully, and you have to approach it globally. So, Corinne, if we can help you, give me a call.
Yes, sir. Yes, sir.
Thank you for your call.
Have a blessed day.
Bye-bye. That's kind of covers everything we were talking about, and seriously looking at things multidimensionally, things like that just don't happen. They slowly, insidiously break down. There's a lot of strong people. We see construction workers and contractors and people who are on the desk, athletes, that they do one thing all the time and they forget about the rest of their body, inflammatory process, whether nutrition. They look at the energetic platform, and it's depleted because they have stresses in their lives. Biochemistry, they're not putting things in their body that should be there, and their body becomes more inflamed and so forth. Now they're a perfect storm.
Yeah, it's interesting that I remember treating an MS patient when I was doing house calls in Arizona way back in the day, and we had to have a conversation on where we wanted our treatment to go because she was definitely doing a lot of Western medicine treatments. And so I had to consider that almost as an external factor. Where do you treat somebody with the medications that they're on? Where do you treat them with their occupational jobs, knowing that they're going to go back and do something over and over and have repetitive injury? But what was interesting about this patient is because of her autoimmune status, they would not do rotator cuff surgery on her. So she was stuck in a wheelchair and, of course, had to use her arms to move around. And we ended up kind of going in there, and I was doing acupuncture on her, not only to boost her immune system, to boost her basically vital force, but also to treat the shoulder injury because she didn't have any choices. So I think we see a lot of patients coming in where they have one issue on top of another issue on top of another issue, and you have to address everything, which makes it much more complicated for us because we're not just the one person focusing on the autoimmune disease or the one person focused on that muscle tear.
No, truly compounded injuries. And the patient comes in and we sit down with them and we go over everything that we possibly can as far as diagnostics. And we say, this is going on, this is going on, this is going on. The person said, well, I just came in from my shoulder. And so the problem is we're trying desperately to answer the question why it occurred in the first place. If you don't answer the question why, then you end up with a rotator cuff like our last call, like Corinne, and she ends up with surgery. And, but it still doesn't answer the question why it took place and why it was there and what broke it down. And when we start looking at the intimacies of the energetic system and muscles that relate to different organ systems and nutritional components, and, you have patients that come in and I tell them, you've got to change your diet. Well, they say, great, I don't cook, and they're fast food, junk food experts, they grab what can, but there's no nutrition in the food. There's no energy. There's no life. Now that's what we're dealing with. This Wednesday evening, Dr. Stephanie Pina will be your host, your presenter at the Roselle Center for Healing in Fairfax. She's going to be talking about autoimmune diseases and how they're handled with Asian application. And what we're talking about in Chinese medicine, Asian application, is looking at the body as a system, not a compartmentalized complaint, if you will. And if you really have any of these things that you think you might have, you don't feel good, nobody's been able to find the answer. As we said earlier, too sick to be sick. and just I don't feel good and I can't seem to snap out of it. This is an opportunity. Take advantage of these classes. All you have to do is go online at rosellecare.com and register. We need a registration because those of you who've been to the classes before know that sometimes we're jammed and we, sometimes we'll do it a second time, but generally we will not. And, you want to take the opportunity to be educated. Either that or call 703-698-7117. Let's get a little bit more in depth. Let's kind of pick at something just to see how it unfolds so our listeners can understand it. Let's talk about a thyroid problem. Okay? In traditional Chinese medicine, a thyroid problem is not necessarily a thyroid problem. But in Western laboratory diagnosis, if you have alterations in thyroid stimulating hormone, thyroxine, which is T4, T3, but more importantly, let's talk about autoimmune reactions since this is the topic. Hashimoto's thyroiditis. If you have something called TPO, thyroid peroxidase antibody, is elevated, by definition, the patient is a Hashimoto's patient. Period. End of story. End of definition. But you have to be able to deal with that and find out from our business, not just throw them some T4, which, by the way, can make it worse because it's a corn derivative, and a patient who's a thyroiditis patient has to be off of grains completely. But how do you get to that place of treatment from what we're talking about? Here's a real autoimmune condition. How do you deal with it?
Well, one of the things you got to stop thinking of it as just its symptoms and its lab work, like we keep saying. A lot of times when people come in, it may not be the main complaint they come in. They might come in for that shoulder issue, and then they've been already diagnosed. So it's already been overlooked because it's under treatment currently. So I have to look at that as an external factor and why that might be creating other health issues. From a Chinese medicine perspective, the immune system is governed by the lungs, but then there also is a deep connection with the kidneys, which are like our adrenal glands. We know that the endocrine system that's in charge of a lot of different hormones, including thyroid, has this interconnection within it. So we have to find where's that break between the body saying, I need to produce more thyroid hormone and less thyroid hormone. And how do we break it down so that the body can utilize what it's already producing and balance itself out?
So let me ask you a question. You touched on something. You talked about the lung. Now, obviously, I know where you're going, but I want you to talk about so our listeners get it. You said, and patients out there, lung. How does the lung have anything to do with immune reactions whatsoever? Well, we've talked about, not only exposures biochemically, we talked about structural injury, and we talk about the mental state, because the body truly walks in tandem, whatever your foremost thought is. And we know that every organ system has an emotion. The emotion for the lung is unresolved grief. And so here's the question. If something has happened in somebody's life where they haven't come full circle, whether it's a loss of somebody, a death in the family, multiple deaths in the family, if it's somebody who lost somebody, in a relationship and they just have never resolved it, something has happened to them over a period of time and they've never resolved that thing. Is that what we're talking about that can suppress the lung, number one? But number two, how does that lung have an effect on immunological responses?
So it can be part of it. Certainly when we talk about internal factors in Chinese medicine and external factors, the unresolved grief or the emotional part can be one of those internal factors. So it almost is like setting the stage. Or it may be the trigger that puts us over the edge. The lungs in Chinese medicine, if you think about the way that they work, it doesn't just govern respiratory health, but if you think about it, when we breathe in bacteria, we breathe in infections, that's the first way in, right? It's going through the lungs, it's going to our chest cavity. That's how we have exposure. So in Chinese medicine, the lungs are a part of the immune system. It's the main part of the immune system because what is it? It's our outside environment able to get to the inside environment. And our coughing and the phlegm and all the things we talked about during the allergy stuff that are trying to get everything out, think about it, the lungs will produce that phlegm also to kind of clear it out as best as possible. But when it gets stuck in there, that creates that deeper issue. Bacteria can build up, viruses build up, they go into the rest of the body. So our lungs in Chinese medicine are the immune system that's kind of circulating at the body, making sure that things aren't going any deeper. It's on the outer source of the body. They actually will say it's like the army kind of circling around the body. So when you get those fever, chills, or that achiness that you get, like the first kind of sign of cold flu infections, like that's your lung system. And what ends up happening is you end up having to increase your temperature to fight that off. You may start breathing heavier. There's a lot of different things that are part of respiratory, but we have to think of it a little bit differently. 3,000 years ago, the lungs were essentially that big part of the immune system was there to protect us from that outside environment coming in. So they didn't have to say, oh, this is a petroleum exposure or a mold exposure, but they knew that there was an importance that the lung played in the immune system. And so that's one of the things you have to check in that's really important with an autoimmune disease. And someone might not come in with a respiratory infection, but it may have been an infection just like that grief that they didn't get over a long time ago that's now causing more havoc in their system.
This is an incredibly fascinating subject. You know, in all the years I've been in practice, I keep coming back to basics, and this is the basic. You know, the emperor's physician was paid to keep the emperor and his family well, not to get them better after they got sick. And that's what we miss in our society. It's about maintaining optimization of health, not trying to recapture and repair it once it's destroyed. And if we could get that concept down, you talk about saving trillions of dollars in the healthcare system, that's the way it needs to go. We're coming up to a break. This is this Wednesday evening, the 5th of the month, 7 p.m. at the Roselle Center for Healing. Join Dr. Stephanie Pina and really get a full understanding of why your immunological system may not be optimal, but more importantly, what you might be able to do about it maybe once and for all. Don't go away. This is an amazing topic. We'll be right back.
105.9 FM and AM 630 WMAL.
Welcome back, everybody. You're listening to Dr. Tom Roselle live, as you do every Sunday at 12 noon on the Eastern Seaboard. And those of you who are listening every place else, well, thank you very much. You know the drill. You know the time. And again, we'd always like to salute and thank our men and women in service for things that you do for us, and without you, we couldn't do them. But hopefully this program continues to serve you, as many of you have reached out and continue to ask questions. I hope that what we do for you is a smidgen of what you do for us. 888-630-9625. That's 888-630-9625. Love to hear from you anytime, and when we're not here, go to rosellecare.com and send any of the doctors a note if you need to have something right away. Just call 703-698-7117 and ask to speak to one of the doctors at the Roselle Center for Healing. They'll get back to you and answer your questions as best they can. But more importantly, this Wednesday evening at 7 p.m. at the Roselle Center for Healing in Fairfax. Join us. Join Dr. Stephanie Pina. She'll be your host, your presenter, my guest today in studio, and she's going to be talking about your immunological conditions, you know, all those things that have been bugging you, from Hashimoto's to cancers to MS to psoriasis to Sjogren's to irritable bowel problems, you name it. They're all immunological responses gone bad. How would you like to find out what to do about them? But more importantly, why behind those things that they show up? The 5th, Wednesday, 7 p.m. Make sure that you register. Dr. Stephanie, let's get into, you know, a couple things, but more importantly, what are you going to cover and how are you going to go through this matrix? Because it's something that, you know, you're going to spend an hour and a half or whatever it is that you're going to spend going through this and giving applications. And, you know, I got 42 years in this thing and I just keep going back to it. So, you know, what's going to be the outcome, the benefits, and what are you going to cover?
Well, I think getting a better understanding of what's going on with the body, the causes of it outside of the laboratory reports, but taking that into consideration. We have patients that come in all the time that their autoimmune disease or a factor of it is a snippet of their healthcare conditions going on. It's been either overlooked or it says it's managed without, it's really not. And so we need to kind of look at things from overall, find that root cause and try to figure out how can we affect everything moving forward from today. The people that are aggravated because they still don't have their diagnosis from their medical doctors, because a lot of autoimmune diseases are they look like everything else. They may not have exact symptoms and exacerbations the way it should be in the books. We need to go through that and kind of understand that they do have a way to kind of help themselves, and that we're here to support that. And through Chinese medicine, which doesn't just mean acupuncture, that means looking at diet, lifestyle, those external factors, the internal factors, looking at from multiple ways, how do we adjust the immune system and the rest of the body to best prevent disease, but also to encourage the healing that's going on right now.
You know, it's an incredible application of insight when it comes to this topic. Asian medicine in its response to virtually everything. And it's one thing that we've lost. We've lost looking at the why. Why is that? And, we purport in our practice to look at the structural, chemical, emotional platforms and the factors that they have an input effect upon from the nervous system and the blood supply and removal of waste to the lymphatic system, spinal fluid function and buffering, the energetic platform and the acupuncture system. But all of those are part of Asian medicine. That's part of the whole perspective, the platform of what you're going to cover.
Yeah, it's not just about what the treatment is. It's about where you are within that system as well, too. You can't start treating if you don't know what you're treating, right?
Exactly.
It sounds weird, but it's true. Someone can't just walk into the room and I automatically go, this is what magically is going to cure you. I need to know about you. I need to know your story, and that's what we're going to go through and really find out how do patients help physicians really create their own health and healing.
How would you like to have somebody that actually listens to you for a change? Well, this is an opportunity. Dr. Stephanie Pina, starting with this Wednesday evening. Join her, and I promise you're going to walk away with a whole lot of knowledge.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
This is Dr. Tom Roselle. After 38 years of practice and almost 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.